Some of the most dangerous diseases we face don't actually start with us. They begin in the wild, quietly circulating in animal populations before they make the jump to humans. Scientists call this a zoonotic disease. Ebola virus disease is one of these. It belongs to a family of viruses called filoviruses, named for the way they look under a microscope. This image shows exactly what that long, winding, thread-like structure looks like. In the case of Ebola, the virus's natural home is deep in the forest. Fruit bats are considered the primary carriers, living with the virus without getting sick themselves. But other wild animals can carry it too. Handling or hunting monkeys, chimpanzees, or forest apes carries a serious risk of encountering the virus. So, how does a virus living quietly in a forest bat end up causing an outbreak in a crowded city? It relies on what health experts call a chain of transmission. Ebola can't travel on its own. It needs a very specific series of physical connections to move from one living thing to another. If we want to stop it, we have to understand exactly how that chain is linked together. Here is the first link in that chain: the jump from animal to human. This happens when a person directly touches an infected animal, or when they handle and eat contaminated wild animal meat, often called bushmeat. Now, before we look at the next link, we need to clear up a common fear. Ebola does not spread through the air. You cannot catch it simply by breathing the same air or being in the same room as someone who is sick. The second link, human-to-human transmission, requires intimate physical contact. The virus only spreads when healthy skin or eyes come into direct contact with the bodily fluids of an infected person, like their blood, sweat, or vomit. That also means you can get sick from touching objects that have those fluids on them, like soiled clothing, bed sheets, or used medical equipment. Because the virus demands this exact direct physical contact to move forward, the transmission chain is actually quite fragile. It is a chain we can clearly see, and more importantly, one we can avoid. Once a person is exposed, there is a waiting period. This timeline shows how the virus hides silently in the body for anywhere from 2 to 21 days before the first signs of illness appear. When symptoms do show up, they are deceptive. It starts out looking like a standard flu, bringing a sudden fever, chills, severe muscle aches, and a sore throat. But as the virus multiplies, the body's systems come under heavy attack. The patient experiences severe stomach pain, vomiting, and diarrhea. Soon, unexplained bleeding can start under the skin or from the gums. If the patient doesn't get medical help, this massive loss of fluids leads to liver and kidney failure. The body goes into shock, and patients often pass away within 6 to 16 days of feeling that first symptom. Because the later stages of the disease involve massive fluid loss, the patient is highly contagious. Keeping them safely isolated behind physical barriers, as in this ward, ensures they get care without putting their families or doctors at risk. But here is the good news. Because we know exactly how the links are formed, we hold the power to break the chain. The first chain breaker is simple hygiene. Washing your hands frequently with soap and clean water, or using an alcohol-based sanitizer, destroys the virus on your skin before it can enter your body. The second chain breaker is physical protection. Doctors and caretakers wear specialized suits, gloves, masks, and goggles so they can treat the sick with zero risk of touching infectious fluids. The third breaker involves how we treat the dead. Tragically, victims of Ebola remain highly contagious even after they pass away. To prevent new infections, trained teams step in to handle the body safely, replacing traditional mourning rituals that involve touching the deceased. And finally, we have an active medical shield. The RVSV Zebo vaccine is a powerful tool used to protect healthcare workers, high-risk individuals, and the close contacts of anyone who gets sick, stopping the virus in its tracks. Ebola is a severe disease, but it relies on us making contact to survive. By practicing strict hygiene, trusting safety guidelines, and seeking medical help early, we take away its path forward. We break the chain of transmission, and we protect our communities.